Dr. Neil Trivedi, Senior Consultant Urologist at KIMS Hospital, Secunderabad. Today I am going to talk about kidney stones. Kidney stones form because of some formation of crystals in the kidneys. This happens when there is a hypersaturation and the crystals which are formed, they get deposited. When lot number of crystals get deposited, they aggregate together to form a kidney stone. Now, who have the risk of kidney stone formation, or in other words, what are the causes of kidney stone? This would be people with sedentary lifestyle, people who get dehydration, or those who don't drink enough of water. Some people have got a genetic predisposition, and others who have got a foreign body inside the urinary tract. These people are more prone to stone formation. Where exactly do the kidney stones form? The kidney stones form in the kidneys, but they can be found anywhere along the urinary tract. By urinary tract, I mean that from kidney to ureter into the bladder. These are the constituents of the urinary tract. So, kidney stones may be found anywhere along the urinary tract. Now, coming to the symptoms of kidney stones. The symptoms of kidney stone, the main presenting symptom of kidney stone, which everybody is well aware of, is a excruciating pain in the flank. Flank is the region of the body just below the ribs on the back side. This is referred to as flank. So most of the patients, they have a severe excruciating pain in the flank which radiates towards the groin. So this is the typical symptom of a kidney stone. Apart from this symptom, there might be other symptoms like vomiting sensation, or some patients may have vomiting, and apart from that, some patients may have fever. So these are the main presenting symptoms of the kidney stones. Rarely some patients, they present only with hematuria, which means the passage of blood in the urine. Coming to the treatment of kidney stones. The treatment of kidney stone depends upon the site and the size of the kidney stone. Site, by which I mean that where the kidney stone is present in the urinary tract, and size. So size, it depends whether the stone is small or it is large. For example, if the stone is around 5 mm in the kidney or in the urinary tract, this type of stone is likely to pass out in the urine, and we need to do only conservative management. This can be confirmed by doing a CT scan, which gives an accurate idea of the measurement and also whether the stone is likely to pass in the urine. By that I mean, if the ureter below the stone is not narrow, then such stones are likely to pass in the urine, and we start treatment to help the stone to get flushed in the urine. The other forms of management are the surgery for kidney stones. When the stone is unlikely to pass out in the urine, we have to go for surgical treatment. Coming to the kidney stone removal. So as I was mentioning earlier, the stones which are larger than 5 mm, they may require some sort of removal, and this removal of kidney stones, by that I mean different surgical techniques would be there for stone removal depending upon the size and the site of kidney stone. Coming to the removal of stones from the kidney, there are various methods to remove the stone from the kidney. If the kidney stone is approximately 1 cm in size, situated in the upper half, by that it is the upper pole or the mid pole, such stones are likely to come out after being fragmented. So the technique used is called as the ESWL, or extracorporeal shock wave lithotripsy, where there is no incision required or no other procedure required, only a DJ stent, a small tube, is placed from the kidney up to the bladder. This is referred to as the double J stent, or commonly referred to as the DJ stent. So this DJ stent will keep the ureter wide, and after the fragmentation of the stone by the extracorporeal shock wave lithotripsy method, the fragments will be drained out in the urine. This is one of the methods. The disadvantage of this method is sometimes the incomplete fragment clearance, or it can not be applied in the stones which are there in the lower pole of the kidney, because such stones may not come out even after being fragmented. Coming to the next and the most common method which is now being used these days is the laser removal, which is commonly known, and it is referred to as the RIRS or the retrograde intrarenal surgery. Retrograde intrarenal surgery can be done in two ways, that is in two stages. The first stage being the insertion of the stent and then removing of the stones after a week or so. The other method of doing RIRS is the primary RIRS, which means it is done in a single stage where a scope is flexible ureteroscope is introduced into the kidney from the ureter with the help of a access sheath. Here the stone is directly visualized and it is fragmented with laser energy. The other method and the next common method used for treatment of stones which are approximately more than 2 centimeters is the Pcnl or the percutaneous nephrolithotomy. In this method we make a small hole into the kidney which is dilated, and then the instrument called as the nephroscope is inserted. The stone is directly visualized and fragmented, and the fragments are retrieved at the same time. After all stone removals, it is necessary to put a stent for proper healing and drainage of residual fragments. So these are the main methods which are used to remove stones from the kidney. The other method is called as the pylolithotomy or the open removal of stones, which is nowadays used very rarely for extra large size stones. And the other methods for removing the stone from the ureter are referred to as the URSL or ureteroscopy with lithotripsy and laser URSL. So these are the stones, removal of stones from the ureter. Removal of stone from the bladder is done by a simple technique called as the cystolithotripsy, where a stone crusher is introduced through the urethra. The stone is directly visualized and fragmented, and all the fragments are retrieved by doing a bladder wash. So these are how the stones are surgically removed whenever necessary. So this ends the talk on the removal of kidney stones. For any further details, you can consult me online on the MFine app.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.